Hi friends! So I'm sitting here on my living room floor and I'm reading, and I've been lying on my stomach for probably 2 hours and my neck is hurting from lying on my elbows with my neck in this position. And I already had some neck pain earlier this week and it's been bugging me, and every time I turn my head to the right or side bend this way, I get some pain. It's like I have a little kink in my neck. I think I slept wrong a few nights ago and I have been dealing with this. I have a friend at work who has been working on my neck a little bit and it's been feeling a little bit better, but I think I just re-aggravated it by lying in this position for hours. So I decided, since I'm a physical therapist, and I know what to do for it, and where we sometimes make the worst patients, I thought I would actually do my exercises. So I wanted to share a little tip with some people. If you have any neck pain, I wanted to share an exercise that can help. It can help reduce neck pain with or without referral into the arm or into the shoulder blades. And it's really, really beneficial when you do it properly and just when you do it regularly. And I have not been a good patient. I haven't been doing my exercise. So as I lie here reading my book in this position, I finally decided I needed to give my neck a little rest. And so I sat up and did my exercise. And then I added a little bit of extra pressure, I guess, to the exercise by using my yoga strap. So I'm going to show you without first, and then I'll show you how I use the yoga strap to do the exercise. The exercise is pretty simple, and a lot of you, if you've ever had physical therapy for your neck, you may have had a physical therapist show you this exercise. It's called retraction, neck retraction, or some people call it a chin tuck. And I'm going to show you the proper way to do it so that you actually benefit from the exercise. And then I'm going to show you a little addition to it that can help as well. So the first exercise is called retraction, neck retraction. And it's kind of funny, you're giving yourself a double chin when you do this exercise. But the important thing is to keep your head level and try not to deviate your head down or up when you do the exercise. So you want to keep your head level, looking straight ahead, and then you're going to draw your chin back in towards your spine. So usually I do this sitting in a chair, but it works unsupported as well, or standing. So I'll do that again for you so you can see it. Giving yourself a double chin and then bring it forward. I'll turn to the side so you can see it as well. So it kind of looks like this. And you might see my chest rise a little bit. That's okay. That just means I'm getting to end range. So another way you can do it is take 1 or 2 fingers on your chin and give yourself a little bit of overpressure. And then you relax. So you retract, hold for a second, and then relax. Retract, relax. So you might feel like your head's tipping down a little bit, and it will just a slight bit, but it shouldn't go here. Shouldn't be like this. A lot of patients that I've seen who've learned this exercise before, sometimes will come in the clinic and they'll start doing this. They're like, yeah, I've done this exercise before, but that's not the exercise. So you want to keep your head level. I oftentimes will tell patients, imagine that your head is sitting on a shelf and you're just sliding your head back on that shelf. So you're not rolling your head back, you're just sliding it. So it looks like that. Here comes a cat. You might see a tail. Okay, so you're going to do that 5 or 6 times, and then the progression is called retraction with extension. So you're going to add extension to that, and what that looks like is retraction. So from this fully retracted position, you're going to roll your head back, and then come back to neutral. Retract, extend, and back to neutral. Retract, extend, and back to neutral. And the goal is to get to end range, so all the way back, as long as it's not hurting. So if you're going here, and that's as far as you can go without pain, then you just stop there. And each time you do it, you should be able to go a little bit further, but make sure that you're not pushing or creating more pain, pushing into the pain too much to where you're creating more symptoms. And so what we want to happen when we do these exercises, we want your pain, if it's in your arm, want your pain to move into your neck, centralize is what we call that, to the neck. Or you want it to go away completely. If the exercise makes your pain worse by making the symptoms move further down the arm into the hand, you may need to discontinue the exercise. But if you're getting some pain radiating, moving back up into the neck, that's a good sign. But what I did, because I felt like I wasn't getting quite enough out of that movement, is I took my yoga strap and I just kind of put it on the back of my neck. And I gave myself a little bit of leverage here. So I retract and then extend over the yoga strap. And back to neutral. Retract, extend, and back to neutral. And another thing you can do at end range when you get all the way back there, so you can add a little bit of rotation. And what that looks like is this: retract, extend, just a slight rotation, and back to neutral. Retract, extend, and back to neutral. And the prescription for that is to do the exercise every 1 to 2 hours, which is about 6 to 8 times a day if you're having neck pain. I would encourage you to consult a qualified McKenzie practitioner. That's a physical therapist. There could be a chiropractor or a DO that specializes in that method, or go to see a physical therapist, a licensed physical therapist, if you're having neck pain. But that's just a simple exercise you can do. It's just this: retract and extend. And you're going to do that every hour, about 10 repetitions. So good luck.